Welcome back to Church in the World. This is the third and final part of our discussion of the healthcare statement, which is caring for health, our shared endeavor. And this is the statement in 2003 made by the ELCA, the Evangelical Lutheran Church in America. And today we're going to talk about equitable access to healthcare for all, and a little bit of ethical guidance around healthcare decisions. Some things that we need to summarize very quickly. In our first part, we talked about how the healthcare system is currently in crisis, about how the church's mission of healing and which the church supports healthcare efforts and the common endeavor for the providing of care for all health, how health is holistic and is communal, spiritual, mental, and physical. Involves our entire person and our entire society. And no, I can't be healthy without caring for your health, and you can't be healthy without caring for my health. That illness is the disruption of wholeness and disruption of unity. Healing is wholeness in body, mind, and spirit, and restoration of that unity. Healing is something the church has been in the business of ever since Jesus Christ's ministry on earth. That healthcare is a shared endeavor then between the individual, right, and their relationships and spheres, the church and its relationships and spheres, and the whole society, the social and communal level. Okay? Then in our second part, we talked about a vision for this involving personal health, congregations, social ministries, advocacies, and how we can look and work for better healthcare services. How that's going to involve public health services, the government healthcare services, cooperative and international healthcare services, holistic patient care, caregiver support, research and technology development, and professional education for all health caregivers and healthcare workers. So today we're going to talk about equitable healthcare, access to healthcare for all, and healthcare ethics. So the system of healthcare is far from that we have visioned is far from a reality today, and will be achieved only through thoughtful engagement by all components of society. One major challenge is achieving equitable access to basic healthcare for all people. Remember, we said last time that is a basic understanding, right? Access to basic healthcare for all people in mental, spiritual, and physical health is a basic thing that our society should guarantee to all people. End of story. And we're nowhere near there. So we are committing to achieving this goal. Understand that at the center of Lutheran ethics is this word agape, which is a Greek word for love. That's in Greek, it's often translated or interpreted as the love of the divine, the self-giving, selfless love shown to us by God through Jesus Christ, who laid down his life for us so that we may have life and have it abundantly. So, First John, and we just heard this past Sunday. How does God's love abide in anyone who has the world's goods and sees a brother or sister in need and yet refuses to help? So we work to promote the health and healing of all people. We are also compelled by justice, right? So we're compelled by love and by justice. Jesus called justice one of the weightier matters of the law, too often neglected by religious people. Our search for justice is a call from God, and because health is central to personal well-being and functioning in society, a just society is always one that supports the health of all its members. So our common effort is to provide access to health care for all. That is a matter of social justice for all people. Justice requires giving each person their due. Healthcare is the kind of good most appropriately given on the basis of need, right? And so we reject healthcare distributed on the basis of merit, social worth, contribution, marketplace value, ability to pay. Nope. If you need healthcare, you should be able to receive it, and we as an entire society have to make that happen. Okay. Governments or companies decide to pay for some services that people may need rather than others. Eligibility for services and funding may be defined so that some people are included while others are not. We are all familiar with the failings of the healthcare system. It is time to confront directly and urgently the issues of limits and resource distribution to develop solutions that are more just. Remember, this statement was made in 2003. Just saying, it's not a new problem. Justice requires fair distribution of the benefits and burdens of healthcare. This does not mean treating every person identically. It means treating similar cases similarly, right? It means that we have to look at income levels, and the percentage of people with health insurance is lower as income declines, right? Ethnic status is tied to this. Race categories are tied to this. Regardless of whether people have insurance, many members of disadvantaged ethnic groups tend to have poorer health than whites, just as those living in poverty tend to have poorer health than those living on higher incomes. Oh no, healthcare access is tied to wealth. Who could have known, right? It's almost like we've structured this not about just access so that a basic level of healthcare is available to all, but rather we've tied it to market or to some other set of criteria. This is a problem, and we have to change it, right? We are called by love and justice to change it. But while the mandate for equitable access to healthcare for all is clear and compelling, questions about the best organizational and financing mechanisms for achieving it leave room for legitimate disagreement in this church and in society. Because healthcare is one vital social good among many, people also legitimately differ over how to balance expenditures for healthcare with other social good, right? So we have to take personal responsibility for one's own health, and for the health of others, and that can meet some needs. Markets may contribute to improved quality and efficiency, but they also can contribute to increased costs, unequal access, and over and under treatment. Governments are shaped by political pressures and often function with inefficiencies, and yet they represent all citizens and so have a particular responsibility to ensure society's obligations to promote the general welfare, security, education, and healthcare. Public health measures ensuring safe water and food or preventing and limiting outbreaks of infectious diseases are so communal that they can be done well only from the government base with adequate tax dollars, right? Governments also have the unique role of ensuring equitable access to healthcare for all. Now, this role does not necessarily entail a specific governmental program. It does mean, however, that governments have the obligation to provide leadership and coordination in balancing competing private and social interests in moving toward the goal of equitable access to healthcare. So let's just be clear. It is the government's job to lead and make sure that we have equitable access to healthcare. So when we don't, that is a failure in government, period. So we, citizen representatives in government, right, must take on the challenging task of defining the level of healthcare services to which each person should have access. This is a cause of some debate. Look to the above vision, that is yesterday's video, if you want to see some of those things and what we as the LCA have defined them as. Now, achieving all these obligations of love and justice will require sacrifice, goodwill, fairness, and an abiding commitment to place personal and social responsibilities of love and justice above narrower individual, institutional, and political self-interest. And for some people, this may mean paying more in taxes or in direct payments to assure that everyone has care. Citizens should not shrink from these moral challenges. We urge all people to advocate for access to basic health care for all and to participate vigorously and responsibility in the public discussion on how best to fulfill this obligation. The chronic failure of our society to provide its members access to basic health care services is a moral tragedy that should not be tolerated. Right? So, and then the statement basically talks about this parable of the Good Samaritan. We do not have the luxury of ignoring this crisis. Okay, so that's the government public policy thing. Access to healthcare for all that is holistic, communal, physical, mental, and spiritual, that is affordable, and that no amount of poverty will exclude you from, is a basic demand that, and the lack of which is a travesty and tragedy that should not be tolerated. So, how are we going to do that? Tell me what you think in the comments below. Because it's a source of a great deal of public debate, isn't it? Okay, on personal levels, what are our ethical guidance for individuals and families? Okay, decisions about treatments, etc. Health and finitude. First of all, we remember that health and healthcare are based around what it means to be healthy. Health has limits, right? We're not trying to become immortal. Everything eventually fails. Suffering and death come to all. The promise of the resurrection means that suffering and death are not the final word in our lives, so we have to make good choices because our resources are finite and our lives are finite. So we ought always to act out of love, which means giving of ourselves for the sake of others' well-being, doing no harm, promoting the well-being of the neighbor, treating people with respect and dignity as children of God, as whole persons. It also means good stewardship of what God has given us should inform our use of healthcare resources, using them wisely, judiciously, and in service toward God and God's purposes. Congregations are one place in which individuals and families can look to for support and guidance in considering how to do good stewardship around healthcare decisions. And then justice. We have to consider our individual healthcare decisions within the context of the just distribution of healthcare resources overall. Healthcare and its technological instruments increasingly are powerful and expensive. People should not ask only whether they are being served, but also whether anyone is being left behind in the ongoing advance of medical progress. And self-determination. A dominant principle in healthcare ethics is the right of individuals to be freely self-determining with regard to their own bodies and medical treatment decisions. Healthcare autonomy. This principle rightly protects against unjustifiable medical and familial paternalism. This church supports an individual's freedom to make healthcare decisions according to her or his own conscience and moral discernment. Yet, ultimately, people belong to God. The exercise of self-determination should always be understood within that relationship. We deliberate our decisions not merely as patients or caregivers, but as seekers of God's will. And above all, we ask God for guidance, mercy, and forgiveness in all our decision making. What's the summary? Dear friends, this is a thorny issue with lots of different aspects. But I hope that what you've heard is the following. The church is deeply involved in the questions about health and healthcare. The church advocates for access for all persons, regardless of their means or status, to healthcare. Healthcare should be not only physical and mental, but physical, mental, spiritual, and communal. Healthcare must be provided by everyone in the society, from an individual to a congregation to a community to the national government to an international effort. Healthcare must be provided and insured by the government. That is to say, the government may not do the healthcare, but the government has to ensure that the healthcare is accessible to all people. When the government fails to do so, the government has gone wrong and needs correction. So we need to pull together to correct it, because love and justice demand that all persons who are sick, who are ill, who are suffering, whether by their own actions or not, no matter their circumstances, have access to love and health care. Thank you very much for joining me. I hope you'll join me tomorrow when we move from this statement to talk about education. I'm sure we won't talk about the government's obligations in that statement. Warning, we talk about the government's obligations in that statement. Until then, God bless.